Hello everyone, so our group will be present about antispasmodic and gut motility drug. Under antispasmodic drug, will be explained about simeticone, mevaverine and hyoscine butyrbromide. Under gut motility drug, will be explained about metoclopramide and charcoal activated drug. So for introduction, spasm means cramp. So antispasmodic drug is the drug that responsible to release smooth muscle in our gastrointestinal tract and urinary. Meanwhile, gut motility means movement of our digestive system, contraction and relaxation of our muscle that coordinate by our nerve. Motility problem can develop when our muscle and nerve cannot function properly. We use gut motility drug to increase motility of our gastrointestinal smooth muscle and treat motility problem.
I'm going to talk about simeticone, which is antispasmodic drug. So the general uses for simeticone is an anti-gas medication and used to relieve the action of muscle contraction, especially smooth muscle in the gut. The action is by reducing the gas from gastrointestinal tract. Next is it will also relieve the discomfort caused by too much gas in the stomach and intestine. It will also allow the gas bubbles to merge together for an easier passage. So for the clinical manifestation, it is used in capsule administration to relieve the pressure of excessive gas by breaking the gas bubbles. It is safe to be taken by children, babies, adults and also pregnancy women. So for pregnancy women, as it does not cross placenta, so it is safe to be taken. You need to consult your doctor first before using simeticone if you're having the condition of phenylketonuria, as the liquid form of it may contain phenylalanine. Lastly, it can also reduce the gas shadow for better visualization of ultrasound imaging tests.
Hi, I'm NAIEM. So, mechanism of action of simeticone. It cannot be absorbed by our gastrointestinal tract, thus it will be excreted via feces unchangedly. Simeticone will prevent the formation of mucus gas pocket in our gastrointestinal tract by reducing the surface tension of gas bubble and excrete them via fart or bulk. The side effect of simeticone is none. But if you have unusual symptoms, you must tell the doctor. Precaution before taking the simeticone. You must tell the doctor if you have any allergies toward capsule contains such as gluten and other else. And you need to tell the doctor if you have pregnancy or breastfeeding. Thank you.
So next, antispasmodic drug is mevaverine hydrochloride. Mevaverine is used for irritable bowel syndrome and other similar problems like spastic constipations, nervous diarrhea or mucous colitis. And this mevaverine will act on smooth muscle of the gastrointestinal tract to relaxing gut muscle that having spasms. And the usually dosage is 1 tablet for 3 times a day.
The exact mechanism of action by mevaverine is still unknown, but there are several mechanisms that may exert the spasmodic action by this drug, include firstly, changes in ion channel permeability, where it causes a decrease in ion calcium influx and causing the excited membrane to be stabilized. Second, it exhibits antimuscarinic or anticholinergic effect, where it prevents the uptake of acetylcholine and then causing a reduction in gut motility. Those who consume this drug may have side effects like wheezing, difficulty in breathing, swollen face, neck and throat, skin rashes, and sometimes in rare conditions it leads to anaphylaxis. Precautions should be taken into measure are for individuals with sugar-related rare hereditary problem, women who are pregnant, breastfeeding or trying to get pregnant.
Next, we go to hyoscine butyrbromide. Basically, it used to treat irritable bowel syndrome that characterized by the painful spasm in the muscle of GIT. Okay, the clinical manifestation, the indication, HBB is taken by an adult or children that 12 years old or above in tablet form who suffered smooth muscle spasm of GIT. Clinical effect of HBB act on cholinereceptor on smooth muscle of GIT to reduce the parasympathetic effect, thereby it relieve the pain of stomach and bowel spasm. Okay, next we go to mechanism of action of HBB. We take a look for this picture. This picture is exactly about the parasympathetic pathway or cholinergic pathway. So as we know, cholinergic pathway is related to the acetylcholine for the neurotransmitter, and we have nicotinic receptor, muscarinic receptor, and the ganglion and the neuron. Okay, so what the HBB will do to this pathway? Okay, actually HBB is an anti-muscarinic agent which have high affinity to bind to the muscarinic receptor rather than acetylcholine. So when the HBB bind to the muscarinic receptor, it will prevent the parasympathetic effect. When the parasympathetic effect have been blocked, the muscle spasm will be relaxed. Okay, and besides, the HBB also bind to the nicotinic receptor and then block the action of ganglionic effect.
So today I'm going to present about the side effect and precaution of HPV drug. Okay, the side effect is postural hypotension, tachycardia, increased sensitivity to light, abnormal heartbeat, vomit, dry skin, rashes on skin, and constipation. So this is precaution just only for general, but I will focus for specific. So cardiovascular, the patient which has cardiac condition should use buscopan with caution. And then gastrointestinal needs extra caution with patient that has reflux esophagitis or other GIT disease. And next is genitourinary, need parenteral buscopan also. Ophthalmology, patient should be cautioned about potential visual problems. Next is fertility, pregnancy and lactation. Pregnant women are not recommended to use this drug, but if they want to use this drug, they need advice from the doctor. Next is pediatric, not recommended for children. And last is geriatric, because this patient are danger of precipitating undiagnosed glaucoma. So that's all from me. Thank you.
Next, I will talk about metoclopramide, which is a gut motility drug. Metoclopramide can be used to treat conditions of the stomach and intestine. First, it can treat gastroesophageal reflux disease, GERD, and gastroparesis, which is a slow stomach emptying. It also can prevent nausea and vomiting that can happen after chemotherapy and surgery. Lastly, it assists with placement of nasal-enteral feeding tube.
So next is the clinical manifestations of metoclopramide. For oral tablet metoclopramide, it is often used for symptomatic treatments of both acute and recurrent diabetic gastroparesis, in addition to the treatments of GERD in patients who have failed to respond to traditional therapy. Meanwhile, for IV form, it is indicated for the above conditions as well as for the prevention of vomiting that may follow anapogenic chemotherapy or nausea and vomiting after surgery. It also facilitates intubation of the small bowel and stimulates gastric emptying through in patients who require radiological examinations of the stomach or small intestine. So for the mechanism of actions of metoclopramide works by inhibiting central and peripheral dopamine 2 receptor and serotonin 5 HT3 receptors in the medullary chemoreceptor tubulin in the area postroma of the brain. Administration of this drug leads to prokinetic effects via inhibitory actions on presynaptic and postsynaptic T2 receptors, agonism of serotonin 5 HT4 receptors, and antagonism of muscarinic receptors inhibition. Hence, the sensitivity of visceral afferent nerve that transmit from GIT system to the vomiting center in the area of postrema in the chemoreceptor tubulin will be decreased. The action also will enhance the release of acetylcholine, causing increase the resting tone of the lower esophageal sphincter, while simultaneously relaxing the duodenal bulb and pyloric sphincter, thereby accelerating gastric emptying and transit through the gut.
Side effects. The common side effects are headache, diarrhea, trouble sleeping, and the serious side effects are tardive dyskinesia, Parkinson-like symptoms, and neurolactic malignant syndrome. For precaution, it should not be used for longer than 12 weeks to prevent tardive dyskinesia. Diabetes people also should check their blood sugar regularly, and pregnant women and breastfeeding women should consult doctor and should use only when clearly needed.
Okay, next is activated charcoal. It is generally used to treat poisoning, med overdose, toxicosis, diarrhea, and flatulence, which mean gases build up in intestine or stomach. It is usually administered within 1 hour of xenobiotic ingestion. The dosage recommended is 50 to 100 grams for the first intake. It can be administered orally, which means by tablet or by tube through nasogastric and orogastric. The indication is for patients that show symptoms of poisoning or cases that aim for GI decontamination. It reduces the absorption and lessens the harmful effect of xenobiotic to body.
Activated charcoal treat patient by binding to poison and reduce the absorption of toxic agent in small intestine. It also easily bind to higher lipid solubility molecule and interfere systemic drug level in small intestine. And it also can administer together with cathartic, as it will lessen transit time in small intestine. Next, the activated charcoal can cause the constipation as it slows down the bowel activity and fecal discoloration because it will be removed together with poison.
For the precaution, it should only be given to those who are fully conscious, considering the risk that it might travel to lung instead. It is also advised to have a prior consultation with doctors before consumption. This is because activated charcoal might reduce the absorption of certain drugs.